Hi, I'm Dr. Amy Stein, owner and founder of Beyond Basics Physical Therapy in New York City. And I just came back from the International Pelvic Pain Society meeting, and I'm excited to talk about some of the findings that they had at the meeting with regard to pelvic pain research. So 25 years ago, when I attended my first IPPS meeting, we were given the examples of pain science and how pain is processed in the brain when you have an injury. 25 years ago, the example was pretty simple, like how it goes to the brain, to the dorsal horn. I'm not going to go through the details, but them presenting it then versus how they are presenting it now, that it's much more complex. There's different avenues that the pain goes through before you actually experience it in the brain. And then to heal the pain, it is much more complex in certain scenarios that we see, especially in our practice here at Beyond Basics Physical Therapy. And then another research showed that with regard to surgery, that surgery years ago was shown to be like, okay, just have the surgery and move on. Well, now there's research coming out that's showing that one, everyone is different. So really understanding the patient, understanding the needs of the patient before surgery, and even before you think of surgery, is essential for your recovery. So they were giving examples of some patients that they may not even need surgery. They need the physical therapy, possibly mental health and nutritional changes. And then that alone can resolve some or most of their pain issues. So it's really been interesting how it's advanced over the years, how we really need to understand pain science even better, but how it has evolved. And then also with regard to surgery, that it's not that simple, that you don't just have surgery, that there are other avenues that most patients need in order to heal. And that's what we do at Beyond Basics. And it is very exciting to know that we are up on the forefront of the research.